I'm Stacy Tisdale for Howdini. It's a classic problem, and for many women, the first sign that they are pregnant. Yes, we're talking about morning sickness. It's not usually serious, but it can be. Here to help you determine whether or not it is and what you can do about it, Dr. Keith Eddleman. He's the Director of Obstetrics at Mount Sinai Hospital in New York and the author of 2 books, including Pregnancy for Dummies. Dr. Eddleman, thank you so much for joining us.
Thanks for having me.
First, what is morning sickness? What causes it?
Well, it's actually a misnomer. It's not just morning sickness. It's really any time of day sickness. And it's a nausea and vomiting that typically occurs pregnancy. It tends to occur early in the pregnancy, in the first trimester, and it's associated with the pregnancy in of itself. No one knows exactly what causes it. It's probably related to a placental factor, the afterbirth, something that the afterbirth produces. Because we know that the more placentas you have, like when you have twins or triplets, the greater the likelihood and the greater the severity of having nausea and vomiting associated with pregnancy.
The thing that's so scary about it is a lot of times people are unable to eat, keep anything down. You're afraid, what's this doing to the fetus? When does it become a problem?
Well, some women have, nausea and vomiting that just is intermittent, it comes and goes, but some people have nausea that's just severe and it's unremittent. And I'd say if you go for 2 or 3 days without being able to take down any solids or any liquids, then that's clearly a time to notify your doctor. That's outside what the typical patient experiences with nausea and vomiting associated with pregnancy.
So 2 to 3 days, then you raise concerns with your doctors. On just a general ordinary basis, what can someone do to alleviate some of the symptoms?
It's a good question. I mean, what we typically tell patients is try to have frequent meals, but eat a smaller amount. I tell people to divide what they would normally eat, into maybe 8 or 10 different little small portions, and just constantly have something by your desk or your bedside, and just eat 1 bite at a time or 2 bites at a time. The other thing you can do is to eat bland foods. Eat foods, this is not the time to eat spicy foods because that's an irritant to the stomach itself. One of the other hints that I tell people, and it makes a big difference, if you can't keep anything down, try a gumball or something that's just sugar candy to keep in your mouth, and even though you don't have to swallow a lot, just the sugar and the glucose in the candy can make you feel better, and it can help you be able to tolerate solid food later on down the road.
In addition to those natural remedies that you were discussing, are there things out there that people can take, people can do to really get rid of these symptoms?
There's some things that work better for some patients than others. One of the things people try over the counter is a combination of vitamin B6 and the sleep medication Unisom, and the 2 of those together have been shown to reduce the symptoms in a lot of women. Some women find some relief with drinking what's called green tea or ginger tea. They find there's some studies to show that helps. But again, nothing works for everybody, and some things work better for some patients than others.
A lot of women out there are trying to balance these awful feelings with work. You mentioned Unisom. If someone, you can't take that if you have to go to work and be awake and try to get through your job. What are some of the best things for people who have to function and work throughout the day?
Well, I think some people should try those things because they don't make everybody sleepy in those situations. But if you really are having trouble maintaining your activities of daily living, like going to work or again, driving, keeping yourself groomed well, then you might be somebody who needs a prescription medication. And there are prescription medications that we use for patients who have significant nausea and vomiting that are safe for pregnancy.
So your doctor can give you some relief. And finally, how long can women expect this to last?
It typically goes away after the first trimester, but there are occasional patients who have nausea into the second trimester, and then there are rare patients who have nausea throughout the whole pregnancy. But for most patients, fortunately, it goes away at the end of the first trimester.
So you're not going to have to suffer, most of us, longer than 3 months.
Correct.
Dr. Eddleman, thank you so much for joining us. Thanks for joining Howdini.
Thanks for having me.